Hi, James. Thanks for coming in today. Do you mind if we use this little interview today on a YouTube video?
Not at all.
Talk about it. So the situation is you came to the hospital here in Waikato because of what reason?
Stroke.
A stroke. Can you tell us how that stroke evolved and how you kind of realized what was going on first and then what was happening to you second?
First thing I noticed was walking down the hall and going to the bedroom, I was hitting the right hand side of the doorway with my shoulder.
Mm-hmm.
A day or two later, I was out mowing the lawns and ran over a small shrub.
Mm-hmm.
I didn't see it. And the next minute, a couple of days after that, or a day after that, I was driving in the car and I had to pull over because my speech went all funny and I had trouble seeing.
And then you realized you had a stroke. And when you came to the hospital, some of the things we did for you was treat blood pressure.
Yes.
Blood pressure down. You got your cholesterol down.
Yes.
And we also started you on an antidepressant. You weren't depressed necessarily at that time, but do you remember why I suggested an antidepressant?
If I remember rightly, you said it was a trial and you thought it would, in my case, it would work.
It would work and help. And do you have any problems with speech now?
I do have trouble getting a right word in a sentence, or I lose words in the sentence, mainly when I'm tired. Other than that, that's good.
That's good. And do you run over any more rose bushes with your lawnmower?
My wife didn't grow anymore, so I kept it out of the way.
How about your visual field? Do you bump into things on either
No.
side like you used to?
No, my eyes are good. I can drive and do things like that now, no trouble.
So at one time you couldn't see a whole half of the world.
That's right. Everything on my right side, I had to turn my head.
Yeah, and we read on the computer today that people with visual field loss is usually irreversible.
Yes, you told me that. Yeah.
But you can see everything. Let's just show the audience that briefly that you can see the whole world. Would you mind just looking straight at me and cover one of your eyes? Great. Let's cover an eye. And if I hold my hand way out here, do you see my fingers moving?
Yes, I see your fingers moving.
And
all the
before
way.
this was the side you couldn't see.
That's right. Yeah.
And you can still see them here.
Yep.
And how about here? Can you see my fingers moving?
Yes, they're not moving there.
They're not moving. Okay.
Yep.
Tell me when
They're moving
they're
now.
moving. Good. You can see them. Now
Yep.
cover the other eye. Good. Same thing. Are they moving?
No.
How about over here? Are they moving?
No.
Tell me when they start moving.
They're moving.
Yeah. So you've had a complete resolution of your visual field loss.
Yeah, my eyes are good.
I think this is good for a lot of stroke patients to see, for them to be able to watch your video and to see that even after a severe stroke where they lost visual field, there's a chance that things might recover. And we have to just control certain things, blood pressure, cholesterol, and in your case, probably the serotonin reuptake inhibitor or the antidepressant might have helped.
Yeah.
Okay, so do you mind if I show the audience just an MRI of the brain and the part of the visual cortex that was damaged also before we conclude?
No, that's good.
Oh, great,
Yeah.
thank you. So James has agreed to show the MRI of his brain, and you can see on the occipital cortex over here there was damage where he had a stroke on the left side, which caused this visual field loss to the right side. If we scroll up some more, we can see this area over here is damaged, becomes a little vacuolated, quite a large area specifically in the visual cortex itself. Traditionally, people don't have recovery of their what's called a homonymous hemianopia, or visual field loss. You can see other parts in James where he's had older strokes. Up in here there's a white mark, some little marks over here, some little bits over here and here and here, other than just his big visual cortex, some little white marks up in there. And then you can see some scattered white areas around. So he's had some old strokes. So even though he had a warning sign of the stroke coming on where he was bumping into things and then ran over the rose bushes, in his situation there were little strokes that were so small that were never noticeable. So now in our situation with James, the important thing is to control the things we can control. If he was a diabetic, then we would be controlling that tightly, but he's not. He does have problems with blood pressure. We're getting that under control. Cholesterol's under control. He doesn't need the SSRI anymore. And he's doing great and living a normal life.